right, this is Apley's. A little bit different than what I taught you in orthopedic diagnosis. In orthopedic diagnosis, we were looking for pain. Now I'm just looking for quality of movement. Again, you've had this. If you've had Dr. Andrews, that's a prereq for this class. So really quick, we're going to measure Kristen's hand. We're going to measure from the distal wrist crease, distal wrist wrinkle, to the tip of the favorite finger. And we decided that she was coming in at 17 centimeters. I'm going to say that her motion is okay if she hits to 1.5 hand length total. So that puts us at 34 centimeters. So you're going to flip around, face the other way. Feet together for me. Good. She's going to go arms out, thumbs and palms, fingers wraps around, one hand up, one hand down. Kristen absolutely nails that. A couple of things that we're going to look at though. Do I have any scapular winging going on? No, I don't. Looks really good. There was no loss in height. Go ahead and go back to neutral. She should not have to jut her head forward just to get this arm behind her head. That's not quality range of motion, okay? That would be bad. The other thing is I didn't want any spinal deviation. Like she shouldn't have to hike a shoulder on one side just to get the hand over, okay? 34 is our number again. Kristen, let's go the other way. One up, one down. Okay, she has the requisite amount of motion. Go back, opposite. Good and go. I will say, so relax. She has the requisite amount of motion. We're not getting any aberrant movement in the spine or the cervical spine when she does it. I do have a small left-right asymmetry. A left-right asymmetry is a predictor of future injury. Depending upon what she has going on as a patient, we may further tease that out. Another thing to notice is for her to go into Apley's superior, I need glenohumeral abduction, external rotation, and then elbow flexion for her to get into that position. Good, and back down. For her to do an Apley's inferior on this side, sorry, thank you. I'm going to need glenohumeral extension, internal rotation, and then elbow flexion for her to get there. I think it's important for your patients, thank you, important for your patients and important on test day, you know those motions that are associated or needed for a good Apley's superior and a good Apley's inferior. The last thing that I'll say, if your patient does not have good thoracic extension, they're not going to be able to get into that Apley's position. So go super slouchy for me. Okay, maybe not that much. That was really good. And go arms out again, thumbs inside pinkies, wrap around and try. Okay, definitely different, okay? If they are in a lot of thoracic flexion, it's gonna be a problem. Go ahead and relax. Name one thing we could do to help our patients gain thoracic extension. It's gotta be the chiropractic adjustment is one thing that's in our bag of tricks that we can do, okay? So that's it for Apley's.